Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer, also an Associate Professor of Medicine, one of the large medical schools in the United States. Today we're going to look at a recent scientific article published in the Lancet about the use of aspirin in the people who had spontaneous intracerebral hemorrhage and they went for surgery and look at the outcome. Okay. If you look at the information on aspirin, studies have shown aspirin has many benefits in many, including coronary artery disease. So when somebody going through surgery, clinician always have the concern. If you start something, is it going to cause bleeding, right? They always delay. I see sometimes a patient came with a gastrointestinal bleeding and patient may be on aspirin Plavix, or they want to stop aspirin and or they want to restart it. When can you restart? That's always the question. So today the situation we're going to take to a different level. The patient underwent surgery for spontaneous intracranial hemorrhage, and when can you safely start the aspirin? That's the question. Okay. So this study was published in LANCET Neurology in December 2024, and the primary author is Dr. Lee Liu, and the senior author is Dr. Yoshioka. Okay. Now, so anytime, what is the clinical question this paper they're trying to answer? The clinical question, can we start aspirin early in the people underwent surgery for intracerebral hemorrhage? And also, what is the different outcome if you start aspirin on day 3 versus starting the aspirin at day 30 after the surgery? Okay. Now, the population they selected, all of these people, the study was done in China, and the population is Chinese people, majority of them 18 to 70 years. They recruited by neurologists, and they underwent surgery for spontaneous intracerebral hemorrhage, and altogether they had like 269 patients. Okay. Now, they have exclusion criteria. The major cardiovascular, cerebrovascular, peripheral vascular events before they entering into the study, they were excluded. Coagulopathy, which can cause bleeding, those people were excluded. If you have atrial fibrillation, those people also were excluded. Now, what kind of surgery? They did the neurosurgeon. They selected, this is very good. They selected the people with the 10 years of neurovascular surgical experience, and they're the one who did the surgery for the spontaneous intracerebral hemorrhage. Please remember that. Now, the intervention was aspirin. The dose they use is very significant up here. They use 100 milligram, okay? And then in the first group, they got two groups. First group, they gave 100 milligram, and the second group also, on the first group, they gave, on day 3, they started the aspirin after the surgery. In the second group, they gave 100 milligram of aspirin on the 30th day. Remember that. Okay. Now, the outcome they looked at it, major, I think they took a composite index of cardiovascular events, cerebrovascular events, and the peripheral vascular events, and they looked at the outcome. That's the major outcome they looked at it, and it should have happened within 90 days of surgery. Okay. Now, they also look at the primary safety event, is there any intracranial bleeding, any other bleeding? That is a safety event also they looked at it. Now, when you look at the statistical study, and again, this is a very good study. It's an open label, blinded, randomized control study. Okay, anytime randomized control study, the values will go up. They use the intention to treat. That means everybody who entered on day 1, they used that for analysis, even if they did dropped out. Okay, the main thing about this study, they did do this interim analysis, look at the safety. There's a statistical method. You can use the O'Brien-Fleming method. So they looked at what they do is so they start the study after 3 months or every 6 months. They look at the data, see which direction the outcome. If these people, more people are dying, then they will stop. Even then the benefit is so huge, they will stop. Okay, that's why they do this O'Brien-Fleming method of the study. They also, again, what are the results when they found out? What is the primary outcome? They looked at the major cardiovascular, cerebrovascular, and the peripheral vascular events. Early aspirin versus late aspirin. When I talk about early aspirin, remember 3 days. Late aspirin is 30 days after surgery. And you look at the results in the primary outcome, the 20% of the have a major cardiovascular, cerebrovascular, or peripheral event in the early start group. When you look at the late people who started aspirin 30 days, it went up to 31%. So huge difference. They did a statistical analysis, odds ratio 0.56, confidence interval 0.3 to 0.98. It does not involve 1, so it's very significant. Look at the p-value, less than 0.05, so p-value of 0.041. Okay, now they also look at the secondary outcome. They look at the death, how many people died in early group and how many died in the late group. So in the early aspirin group, 7% died. In the late start, when you started the aspirin after like 30 days, 16% died, okay? Odds ratio 0.44, confidence interval 0.20 to 0.97, less than 1, significant. Look at the p-value, 0.042, very significant, okay? Now, safety, the main thing, and a thing about this study, they looked at the safety outcome. Is there any bleeding? They looked at any intracranial bleeding within 90 days in both groups. So early aspirin, only 1% bled. In the late aspirin, 3% bled, okay? And it was it was not significant when they did the analysis. So there's not much difference. If you look at the p-values greater than 0.05. And they look at the moderate, severe bleeding in 90 days. Could be bleeding anywhere. Even that p-value is not significant. There's no difference between two groups. So early aspirin is, the bottom line, the early aspirin did not make them bleed, okay? So when we look at the strength, the next thing, let's look at the strength of the study. What's the major strength? Again, this is a randomized control study. Anytime you have randomized control, it's a very strong study. They use the intention to treat analysis, safety analysis, O'Brien-Fleming method, a high impact clinical question. Everybody need to know, right? It's a good clinical question. Everybody need to know. Good statistical design. Okay. Now, weakness of the study is anytime there's multiple centers for this study, right? Every center could be different. They should have done a statistical analysis, see any the inter-center variability. There's some statistical study you can see, is there any different? They should have done it. Chinese patient only, we never know, what happens to whites, African Americans, Asian, the other Asian group also. Did not exclude the patient on herbal medicine. Chinese people are very famous for herbal medicine. When you talk about herbal, Chinese herbal comes in, right? They all can cause bleeding and all of that. They should have asked that question. No mention of blood pressure during the study time. Not before, they didn't mention. During the study time, was there any blood pressure problem? They should have looked at it. I did not see that. They did not measure INR, PTOT, PT, PTT, any of this coagulation profile. The take-home message, don't be afraid to start aspirin early. Okay, so the patient with a spontaneous intracerebral hemorrhage, then they did undergo surgery. If you do start aspirin day 3, that's okay. The outcome is much better. Don't wait to the 30 days thinking, it's safe. It's not. Only it's better when you start on day 3, okay? And no bleeding, they looked at the intracranial bleeding. There's no difference between two groups. Don't worry about the bleeding, okay? So it's a great study, a great clinical question. A lot of people are undergoing surgery for intracerebral hemorrhage. And the clinician always kind of confused. When can I start aspirin? They know the benefit, okay? So thank you so much for watching. Please subscribe to our channel. We want to make this presentation so it's easy for the clinician who doesn't have the time and the effort to go through the whole article, so they may want to read it later on, but they want a nutshell, what is the story behind it. So we'll be making more analysis of the research studies. Thank you so much for watching. God bless.